This is Dr. James, and yesterday I talked about fevers and how the height of the fever wasn't going to kill anyone. And I had a lot of comments about febrile seizures. And so I was planning on doing this video anyway, but there's a common misconception that the height of the fever is what causes a febrile seizure, meaning that if you get to 104 or 105, you may have a seizure. And that's not the way febrile seizures happen at all. A person who has a febrile seizure has a tendency toward febrile seizures. And the febrile seizure is caused by the rate of rise, meaning how fast the fever goes up. So it didn't really matter if the fever was 101 or 102 or 103 or 104 or 105. That's not what caused the febrile seizure. It was how fast it got there. And most of the time, if a kid has a febrile seizure, the parent didn't even know they had a fever, in that the first thing they saw was the seizure because it happened so quickly. They went from a normal temperature to a fever in a matter of a minute or two, and that rate of rise of how fast it went up, that's what caused the febrile seizure. Febrile seizures typically happen from the time the kid's like 6 months to about 6 years of age. We have complicated febrile seizures that are febrile seizures that last longer than 30 minutes, required intervention to get them to stop, that had some associated symptoms with them like paralysis, loss of speech, the inability to see, more than one febrile seizure in a 24-hour period. Those are all complex febrile seizure or complicated febrile seizures. Those do have a higher tendency to go on later and develop epilepsy. But most kids, probably 85 to 90% of kids who have a febrile seizure will only have one febrile seizure in their whole life. So most people who have had a febrile seizure only have one. There's usually no complications or brain damage from febrile seizures. After they wake up, they're fine. And if we can prove that it was just a febrile seizure, we don't even do a workup. There's not any medicines for it. We don't even do EEGs to diagnose them because they have that standard story that goes along with a febrile seizure, and we know that they're pretty benign. So you keeping your kid's fever, giving a temperature, if they have a temperature of 103, and you constantly giving Tylenol or Motrin is not going to keep them from having a febrile seizure. In fact, theoretically, it could make them more likely because you're seeing more ups and downs, and it's the rate of rise that causes a febrile seizure. That's not really what we see, but there's no reason to wake your kid up and give them medicine because if they have 103, they're not going to have a febrile seizure.